Welcome back to the Deep Dive. Today we're plunging into a topic that, well, while it's often overshadowed by the medical news itself, it profoundly affects countless lives.
It really does.
We're talking about the utterly critical, yet frequently bewildering world of health insurance and Medicare, especially when you're facing one of life's toughest challenges.
A cancer diagnosis.
Absolutely critical stuff.
Our mission for this deep dive, it's really to equip you with the knowledge to cut through all the complexities of navigating cancer care costs, understanding Medicare's various layers.
Which can be very confusing.
Exactly. And crucially, how to fight back when a claim gets denied. We've pulled insights from comprehensive sources, including navigating cancer care, Medicare insurance, and denied claims, all designed to help you reduce what's unfortunately become known as financial toxicity.
A very real burden for patients.
You might initially think, managing insurance is just this daunting distraction from focusing on treatment.
Understandably so. But our sources make it abundantly clear. It's actually an essential and empowering part of your overall care.
It truly is. Self-advocacy here is key.
Yeah, this isn't about becoming an insurance expert overnight, but more about learning the basic language, understanding the landscape, and knowing exactly who to ask for help. It's an act of self-advocacy that can significantly reduce stress and let you pour more energy into your health. Okay, let's unpack this and try to simplify the complex.
Let's do it.
So, for many people, Medicare becomes their primary insurer. But it's definitely not simple, not a one-size-fits-all solution. For those maybe unfamiliar or just needing a refresher, it comes in different parts.
Right.
Think of them less as buckets and maybe more like specialized departments, each handling a specific type of coverage.
That's a great way to frame it. These parts are designed to cover distinct aspects of care, and for cancer patients, understanding what each department, let's say, handles is absolutely vital.
Okay, so where do we start? Part A.
Yep. First, there's Part A, often called hospital insurance. This is primarily for your care when you are formally admitted to a hospital. Think an overnight stay, maybe surgery, or inpatient chemotherapy.
Okay, inpatient. Got it.
It also extends to short-term stays in a skilled nursing facility, but only if it follows a qualifying hospital stay.
Ah, okay. That's an important detail.
And it's essential for hospice care, which is a significant relief for many families down the line. Now, what's often overlooked is that while most people don't pay a monthly premium for Part A...
Right, that's the free part people think of.
Kind of, but there is still a deductible that applies per benefit period.
Per benefit period, not per year.
Exactly. A benefit period starts the day you're admitted and only ends after you've been out of the hospital or skilled nursing facility for 60 consecutive days. So, theoretically, you could face multiple Part A deductibles in a single year if your hospitalizations are spaced apart.
Wow, okay. That's definitely something to be aware of. So Part A handles the inpatient heavy lifting. But a huge part of cancer treatment happens outside the hospital walls, right?
Absolutely.
All those consultations, tests, infusions. Where does Medicare come in for that day-to-day critical care?
That's where Part B, or medical insurance, truly shines for cancer patients. This is the real workhorse.
Okay.
Part B covers your doctor visits, including consultations with your oncologist, surgeons, specialists. It pays for crucial outpatient treatments like chemotherapy and immunotherapy infusions, the ones given in a clinic or doctor's office.
Precisely. You're also looking at coverage for radiation treatments, lab work, diagnostic imaging like PE scans, CT scans, MRIs, and even some durable medical equipment.
Okay, that covers a lot. Is this one premium free too?
No. Unlike Part A, you do pay a monthly premium for Part B. For many, that cost is automatically deducted from their Social Security benefits, so they might not notice it as much, but it's there. Right. Okay, so Part B is really where the bulk of the active treatment costs are processed. What about the medications you take yourself at home? All those oral chemotherapies, anti-nausea drugs, pain relievers, that's huge now.
Very huge and growing. That's the realm of Part D, your prescription drug coverage.
Part D, yeah.
Now, unlike Parts A and B, which are government administered, Part D plans are sold by private insurance companies, so you have to actively enroll in one to get this coverage.
Actively choose and enroll.
Got it. And for cancer patients, Part D is crucial because it covers, like you said, the many oral chemotherapy pills, symptom management medications, and other prescriptions you fill at a pharmacy. Each Part D plan has its own formulary.
Its list of covered drugs.
Exactly. It's formulary. So it's absolutely critical to verify your specific medications are covered by the plan you choose and what your share of the cost will be.
So check that formulary carefully. Okay, those three parts, A, B, and D, that forms what we generally call original Medicare, right?
Correct. Original Medicare.
But then there's this fourth option that you hear a lot about, Medicare Advantage. How does that fit into the picture, especially for someone dealing with cancer?
Medicare Advantage, or Part C. Yes. This is a significant alternative to original Medicare. These are private plans, usually structured as an HMO or a PPO.
Like employer insurance often is.
Exactly. And they bundle Parts A, B, and usually Part D into one package. For many people, they seem appealing because they often have lower monthly premiums, maybe zero premium sometimes, and often include extra benefits like vision or dental.
Sounds good on the surface.
But for cancer patients, this option requires very careful consideration. A key difference from original Medicare is that Advantage plans typically operate within a network of specific doctors, specialists, and hospitals you must use.
The network restriction, that's huge.
It's critical. If you go out of network, your costs can skyrocket, or the service might not be covered at all. Furthermore, many Advantage plans require prior authorization for treatments, scans, procedures.
Getting permission beforehand.
Yes. And that can sometimes lead to delays in critical care while you're waiting for that approval. It's absolutely vital to verify that your preferred oncology team, your hospital, any specialized cancer centers you might need, that they are all in network before you enroll in an Advantage plan.
Can check that every year, I imagine. Networks change.
Every single year during open enrollment. Because you're right, networks change. And many leading cancer specialists or specific NCI-designated cancer centers might be out of network, potentially forcing you to switch doctors mid-treatment or face massive costs.
Wow. That distinction regarding networks and prior authorizations is incredibly important. It really sounds like it could be the deciding factor for someone choosing a plan, especially with a serious diagnosis.
It often is.
Okay, that gives us a really clear overview of the parts. But then the financial terms that can feel like, well, like another language entirely.
Yep, the cost-sharing language.
This is where the costs really start to hit home for people, right? And understanding them is crucial for anticipating expenses.
You've hit on a critical point. Understanding these terms isn't just about definitions. It's about anticipating and managing the potential financial burden. Let's start with the deductible.
Okay, the deductible.
This is the amount of money you have to pay out of pocket before Medicare starts to pay its share. And remember, you have separate deductibles for Part A and Part B.
Separate ones. Okay, so for Part B, the outpatient stuff.
For Part B, the deductible applies annually. You pay that amount once per year before Medicare begins paying its share, which is typically 80%.
Okay, so you pay your deductible, let's say for Part B, for the year. Then what? Is it smooth sailing from there, or are there other layers of costs that crop up?
Not quite smooth sailing, unfortunately. The next hurdle is coinsurance.
Coinsurance.
This is your share of the cost for a service after you've met your deductible. For Part B, this is a particularly crucial number for cancer patients. Medicare typically pays 80% of the Medicare-approved cost for services.
Okay, 80% sounds pretty good.
But you are responsible for the remaining 20%.
40%.
Of everything. 20% of the Medicare-approved amount for most Part B services. Doctor visits, chemo infusions, radiation, diagnostic scans.
Okay, now the 20%. It might sound small initially, but let's put it into context. Cancer treatment is expensive.
Extremely expensive. Imagine a common immunotherapy drug or even a complex series of radiation treatments. Let's say it costs $10,000 for a single dose or session, which isn't unusual.
Okay.
That 20% that Medicare doesn't cover, that means you're potentially on the hook for $2,000.
$2,000.
Per infusion, per radiation session.
Wow.
And a typical cancer treatment protocol could involve dozens of such sessions over many months, sometimes years. That 20% isn't just a number. For many, it's a rapidly escalating contributor to that financial toxicity we talked about. It's a huge mental and emotional burden on top of the physical fight.
I can only imagine how daunting that 20% feels, just looming there. How can people possibly prepare for something without a cap? Because if original Medicare follows this 80-20 split, surely there must be some sort of maximum annual amount you'd have to pay. That's what an out-of-pocket maximum usually means in other insurance, right?
And that's precisely where the critical, often devastating difference lies with original Medicare.
Okay.
While the term out-of-pocket maximum generally means the absolute most you'll have to pay for your medical care in a year, original Medicare, Parts A and B, has NO out-of-pocket maximum.
Wait, no maximum.
No maximum. Let me repeat that. There is no cap on that 20% coinsurance you owe for Part B services.
So, 20% just keeps adding up, no matter how high the total cost gets.
It just keeps adding up. For someone undergoing extensive, prolonged, and very expensive cancer treatments, that 20% can add up to tens, even hundreds of thousands of dollars. It can lead to financially ruinous debt. This is honestly the biggest blind spot for many people new to Medicare, and it's why understanding this detail is absolutely paramount.
That's truly chilling. The idea of facing a catastrophic illness and then realizing there's potentially no limit to your financial liability for the critical care you need, it's terrifying.
It really is.
Our sources underscore that this lack of an out-of-pocket maximum is arguably the single most critical financial risk for cancer patients on original Medicare. So, what can someone do? How do you protect yourself against that uncapped 20%? Is there any way to build a shield against such an unpredictable and potentially unlimited financial burden?
Absolutely there is. And this is where Medigap policies become a truly critical safety net. I often call them your financial shield.
The Medigap. Okay, Medicare Supplement insurance.
Exactly. Medigap, or Medicare Supplement insurance, is private insurance you buy specifically to help pay for the gaps that original Medicare doesn't cover.
The gaps like?
Like, most importantly, that 20% Part B co-insurance we just discussed, the part that can otherwise be uncapped and lead to huge bills.
So Medigap picks up that 20%.
Depending on the specific Medigap plan you choose, there are different standardized plans like Plan G, Plan N. Yes, it can cover that 20% coinsurance entirely, or almost entirely. A good Medigap plan will also cover your Part A deductible, maybe your Part B deductible. Some even cover things like foreign travel emergency care.
So it fills in those major cost holes.
Precisely. For a cancer patient on original Medicare, securing a robust Medigap plan is arguably one of the most important financial decisions you can make for your cancer journey. It transforms that unpredictable, potentially unlimited financial burden into something much more predictable and manageable.
Gives you certainty.
It gives you predictability and peace of mind, allowing you to focus your energy on healing, not on battling insurmountable bills. It's not a luxury. For many, it's an absolute necessity.
That really clarifies the absolute necessity of supplemental insurance, that Medigap shield.
Okay.
But even with all this planning, great coverage, Medigap, the healthcare system can still throw curveballs.
Oh, absolutely.
And one of the most common and frankly most frustrating experiences is getting that dreaded letter. Your claim has been denied.
Ugh, yes.
Our sources acknowledge that panic, anger, despair, totally normal first reactions. Who wouldn't feel that way?
It is absolutely frustrating, and it's so easy to feel defeated right then and there. But here's a crucial insight from the materials we looked at. A denial is not a final no.
Really? Not the end of the road?
Not usually. It's more often the start of a conversation, and it's a conversation you can absolutely win. In fact, studies show a significant percentage of initial denials are overturned on appeal.
That's encouraging.
It is, and our source material provides a really clear step-by-step plan for how to approach this. It gives you a roadmap.
Okay, let's walk through that. What's step one when that denial letter arrives?
The first step is simple, but maybe hard to do in the moment. Don't panic. Investigate. Take a deep breath. Look closely at the denial letter or the explanation of benefits, EOB, you received.
The EOB, right, that statement that comes after a claim.
Exactly. It should clearly list a specific reason for the denial. Sometimes, honestly, it's a simple clerical error, a typo in your name, an incorrect policy number, a wrong billing code.
Things that can be fixed easily.
Often, yes, with a quick call. Other times, the reason is more complex, like the treatment being deemed not medically necessary or experimental, or maybe not covered by your specific plan. Understanding that specific reason is your essential first step.
Okay, so find the reason. Let's say it's not just a typo. What's your immediate next move? Do you just start filling out appeal forms then?
No, not quite yet. The next crucial step is to call for a clear explanation. Pick up the phone, call the customer service number on your insurance card.
Okay, brace yourself for the phone call.
Yes. Have all your paperwork right there in front of you, the denial letter, your policy number, the claim number, dates, everything relevant. And then politely but firmly state, I have received a denial for the specific service on this date, and I need you to explain the reason for this denial to me in simple, unambiguous terms.
Get them to explain it clearly.
Yes. And while you're talking, take incredibly detailed notes. Write down the date, the exact time of the call, the full name of the person you spoke with, and get a reference number for the call. Always ask for a reference number.
Why is that so important?
Because this meticulous record keeping is vital. It builds your case. It proves you made the effort, who you spoke to, what they said. It's your documentation if the process needs to escalate.
That's excellent advice, building that paper trail, or digital trail, I guess. But if the denial is about something complex like medical necessity, it sounds like you need more than just good notes. You need your doctors involved.
You absolutely do. Your third and arguably most powerful step is to make your doctor's office your first ally. Your oncology team is your strongest partner in any appeal.
They deal with this all the time, right?
All the time. Their office staff, the billing specialists, the nurses, sometimes dedicated financial navigators, they handle these insurance issues every single day. Call them immediately. Say, I've received a denial for the specific service and I need your help to appeal this.
And what can they do?
They can check for coding errors on their end, first off. But most importantly, they can provide what's called a letter of medical necessity.
Ah, the key letter.
The key letter. It's written by your oncologist, explaining to the insurance company exactly why that specific test, that specific treatment, that medication is critical and medically necessary, maybe even life-saving, for your specific diagnosis and situation. This letter from the medical authority who knows your case inside and out is often the single most persuasive piece of evidence you can provide.
Okay, so you've investigated the reason, you've called the insurer for clarity and documented it, and crucially, you've gotten your doctor's support with that letter of medical necessity. Now it sounds like you're ready to formally challenge the decision.
Precisely. Step 4 is to submit a formal appeal. Your denial letter itself will contain detailed instructions on how to file an appeal, the address, the fax number, maybe an online portal, and, very importantly, the deadline.
Follow those instructions exactly.
To the letter. Don't miss that deadline. Write a short, polite, but firm letter. Include your name, your policy number, the specific claim number from the denial. State the facts clearly and concisely. My claim for service on date was denied for stated reason. I am appealing this decision because the treatment is medically necessary for my diagnosis of your cancer type, as supported by the attached letter from my oncologist.
Keep it simple and factual.
Yes. Attach a copy of the original denial letter and, crucially, attach that letter of medical necessity from your doctor. And always, always make copies of everything you send for your own records before you send it.
Send it certified mail, maybe. Proof of delivery.
Absolutely recommend sending it certified mail with return receipt requested or via a method where you get delivery confirmation. That comprehensive package significantly strengthens your position and proves you followed the process.
Okay, that sounds like a lot of paper, a lot of details to keep track of, especially when you're already feeling overwhelmed by treatment itself. Is there a simple way to manage that organizational burden?
That brings us perfectly to the fifth and perhaps the most critical ongoing step. Keep meticulous records. This is absolutely non-negotiable.
Get organized.
Get organized from day one. Get a dedicated folder, a binder, a digital folder, whatever works for you. Label it clearly. Keep copies of every single letter, every bill, every explanation of benefits, EOB.
Even the ones that are approved.
Everything.
Yeah.
And log every phone call you make, date, time, person's name, reference number, what was discussed, just like we said earlier. Keep track of when you sent your appeal. Note down when you expect a response based on their timelines.
Why is this so critical?
Being meticulously organized does two powerful things. First, it shows the insurance company you are serious, prepared, and not going away easily. Second, it provides you with undeniable evidence if the case needs to go to a higher level of appeal or to a state insurance department or even involves legal action. This organization is your secret weapon. It gives you power and confidence in a system that often feels designed to be confusing and wear you down.
That step-by-step guide is incredibly empowering. It really lays out a clear path through what seems like a very murky process. But wow, it also sounds like a lot to manage, especially during active treatment.
It is a lot.
It's clear that trying to do this entirely by yourself is, well, probably too much for most people. You're already fighting one major battle with the cancer. Adding this whole administrative and financial fight can just feel overwhelming.
Exactly. And the good news is you absolutely shouldn't have to navigate this alone. There are dedicated professionals whose entire job is to help you with these very challenges.
Okay, so where do people find this help? Who should they call first?
One of your absolute first stops should be your hospital financial navigators or social workers. Almost every cancer center or hospital has staff specifically dedicated to helping patients with insurance and cost issues.
They're right there at the treatment center.
Usually, yes, ask your nurse or doctor. These navigators or social workers can assist with everything from helping you understand your specific plan's benefits and limitations to guiding you through that appeals process we just discussed, or even finding financial assistance programs for copays, deductibles, and medication costs. They are an invaluable, often underutilized resource and really a true extension of your care team. Don't hesitate to ask for them.
That's great advice. So your care team can extend beyond just your doctors and nurses to include these administrative and financial experts right there.
Yeah.
What about for specific questions about Medicare itself? Say if you're trying to figure out which Part D plan to choose next year, or if Medigap is right for you.
For detailed, unbiased, one-on-one guidance specifically on all things Medicare, the State Health Insurance Assistance Program, SHIP, is an excellent and importantly free resource. Every state has a SHIP program. They're staffed by trained counselors who can provide personalized advice on understanding your Medicare options, comparing plans including Medicare Advantage and Part D plans, checking if you qualify for low-income subsidies, and even helping you enroll. Because they're state-run, their advice is unbiased. If you have specific questions about Medicare's complexities, this is a fantastic, neutral resource to tap into.
Free and unbiased, that sounds perfect.
Yeah.
And beyond the hospital folks and the state SHIP programs, are there other places to turn for help? Especially if you feel completely overwhelmed. Maybe you've hit a wall with an appeal and you just need a strong advocate in your corner.
Absolutely. There are some incredible nonprofit organizations dedicated to supporting patients through these very challenges. Our sources highlighted groups like the Patient Advocate Foundation, PAF,
okay.
and Triage Cancer. These are amazing resources. PAF, for example, provides free case management services. They actually assign a case manager to help patients resolve complex insurance and healthcare access issues, including digging deep into denied claims and navigating appeals.
Wow, actual case management.
Yes. And Triage Cancer offers a wealth of free education webinars, checklists, guides on a huge range of practical topics, including navigating insurance, employment rights, disability insurance, and financial issues that come up after a cancer diagnosis. Connecting this to the bigger picture, these organizations offer crucial, sometimes literally life-saving support and expertise precisely when you feel most overwhelmed and need a professional advocate by your side. They truly embody the idea that you are not alone in this fight.
That's incredibly reassuring to know those resources exist, because facing down a stack of medical bills fighting insurance companies, it really can feel as daunting as facing the cancer itself sometimes.
It absolutely can.
But our deep dive today has shown us, I hope, that by learning the language, by understanding the landscape of Medicare and insurance, by being meticulously organized, and crucially, by leaning on the experts available to you, the navigators, SHIP, the nonprofits, you can navigate this complex system.
You absolutely can.
It's not just about getting the medical treatment, it's about protecting your financial well-being, which is such an integral and often overlooked part of your overall health and recovery.
Indeed. And what's the ultimate goal here, right? It's to ensure you get the high-quality care you need without suffering devastating financial consequences along the way. This isn't just some bureaucratic battle. It's really about your right to receive appropriate care without facing financial ruin. Advocating for yourself in the insurance landscape, it's a fight worth fighting.
It really is.
Because it allows you to focus your precious energy where it's truly needed, on your health, your healing, and your quality of life.
Well said. So for you, our listener, maybe here's a final thought to mull over as we wrap up. What single actionable aspect of insurance advocacy can you perhaps take control of today? Whether it's making that call to check your Medigap options, finding the number for your hospital's financial navigator, or maybe just starting that binder to organize your medical bills. What's one step you can take to reduce your stress and allow yourself to focus more fully on your health?